The virtual ward and assess and restore program are really transitional programs that help to create some connections. And we have a whole array, both in the hospital and within the community, of excellent specialized geriatric services that we're wanting to strengthen the connections to. These were opportunities that we identified in listening to our patients, listening to our staff, as really being the gaps that were making it difficult for patients to be successful when they returned back home. What we heard was they needed some key elements around making connections back in the community.
The idea was to have a system for our patients that were identified as being higher risk at going home but wanted the opportunity to go home, to provide those patients with the opportunity to have a contact person upon discharge. So we identified 5 milestones as a group. If they were able to achieve those 5 milestones within the 30 days post-discharge, would we actually see a reduction in their readmission rate.
And the virtual ward program is a program that's set up to make sure that clients aren't just discharged from the hospital and left without any connection to their primary care or medications or specialists.
It's the opportunity for the social workers who are navigating these cases, that if patients are having difficulty out in the community, if they're having trouble with transportation to get to any of their appointments, it's being able to give them the resources in order to link with the appropriate community agency or service that would enable them to continue to be independent.
My grandmother had fallen and broken her hip, but for quite a while before that she was having some cognitive functional issues, and when she broke her hip, her independence, everything changed for her, and it just tipped her over into the dementia. I did not know what to do with this disease. I did not know how to cope, and they were there checking up, following up, giving me information, advocating for me and my grandmother to get help brought in so that I would have relief. It was imperative to her care, because I really didn't feel like I had anyone until that virtual ward stepped in. That's the truth. It was so hard dealing with this disease. If I didn't have them, I probably wouldn't be where I am now, where I can actually see me having a life and that my grandmother's cared for.
Patients, when they're in hospital, we have daily bullet rounds on the units, which we discuss discharge planning for patients. So at those bullet rounds, patients are identified as going home, aspects of their discharge that would lend them to being a little bit higher risk. Are they going home alone? Do they have a family doctor? We know that they're going to have follow-up medical appointments. Are they going to get to those medical appointments? But they just might need a little bit of support once they get home. So it's at that point that the interprofessional team identifies somebody as being appropriate for virtual ward and or assess and restore.
What we identified through this program was that there is a subgroup of patients that needed even more support. And this is where the assess and restore program really came forward. This is a patient group that were at risk of potential readmission back to hospital or ability to be able to transition back to the community because they had additional functional or cognitive needs.
Being part of the assess and restore and virtual ward actually happens simultaneously, so it's not an independent entity of one over the other. We would identify them for assess and restore prior to discharge as well. And this is where our partnership with Care First becomes really important, because our in-hospital social workers do carry virtual ward patients, but we also share those referrals with the Care First social workers who are also navigators in this system.
So Care First is a community service organization that has a basket of services. So we have many programs that include a family health team, assisted living program, a home care program, an adult day program, and a geriatric assessment and intervention program.
It's a really good joint collaboration between Scarborough Hospital and Care First, because I guess number one, both organizations share the joint vision of providing better care for the patients and the community.
Most of the clients which we get after hospitalization, they are weak, frail, deconditioned, they have a fear of falling. And most of them have a lot of functional issues, like they don't know how to do their ADLs, activities of daily living, and they have cognitive issues. Most of them have balance problems. They don't know how to use walkers like canes properly. Most of them don't know how to use these assistive devices which can make them more independent and safer. So in our program, we teach them all these skills. We train them in various kinds of physical exercises comprising of balancing and strengthening to make them more independent and safer, both indoors and outdoors.
We also give the clients' families the tools to help their spouses or family member. We also give out handouts to family members on how to do some home exercises.
Sometimes in the hospital or they stay home, they are by themselves. So we give them an opportunity to interact with other clients, to laugh, to have fun, to exercise. And then after that, we just fill in the gaps.
The clients not only benefit physically, but mentally and socially too, because there is a lot of socialization aspect to our program.
It's a great source of comfort for the patients and family, because during that transitional period from hospital to home, it can be a stressful experience, not just for the patient but also for the families too. So when they know ahead of time what are the services and support that are put in place, and they know who will be calling them, it kind of de-stresses the situation for them.
It's nice to see the other side of them, that discharge planning piece, having those conversations, being able to link them to those resources, and being able to see the successes of what that means.
The care was marvelous. I was really surprised. It really helped me. I walked in here with a walker and walked out without anything. I really think I would still be limping around if I hadn't come. If you know anybody that needs it and you can get them into it, do it, because it's worthwhile.